Good noontime, everyone. Thank you so much for joining us. My name is Becky McGregor, and welcome to Your Benefits Unmasked, a special presentation here today from True Health New Mexico on your 2021 benefits. And I want to thank you all for joining us. I also want to thank Fallon Kibler for joining us from True Health New Mexico. She's going to be your presenter. And we are going to move right into it because I know your time is limited. I want to first really give you a couple of quick, high-level reminders to please turn off your microphones as you're entering, either via your phone or computer. Please just turn those off for us. It's just to limit those distractions for everyone. And then also your camera, if you can turn that off also during the presentation. We are going to put questions in the chat box today, not the Q&A section, just because for some odd reason that was disabled. So we're just going to put our questions in the chat box. Please note that we have a Q&A section time frame, so we'll be addressing your questions then. We do have some benefit specialists who are going to hop on the call, and we're going to all help kind of moderate those questions for you. But just stick those in the chat box, but know that we might not get to them right away, but we'll get to them here midway through the presentation. And let me see. We are going to go right into our presentation with Fallon. I want to hand it over to the lovely Fallon. Are you ready to go?
I am. Can you hear me?
We can hear you.
Okay, good. Well, welcome everybody, and thank you for attending today's presentation. I'm Fallon Kibler. I am the supervisor of enrollment and the account manager for Albuquerque Public Schools here at True Health New Mexico. Next slide. Okay, so a little bit about us. We're an insurance company led by physicians who have practiced in New Mexico. Our network encompasses over 10,000 providers across the state and into the border cities of Texas. Next slide. Okay, we at True Health believe in building plans that are affordable to all on all aspects for our members. This also includes accessibility. With that, we have a telehealth network, and we use pharmacy as an extender for accessibility for immunizations and vaccines. Some examples are the influenza, shingles, and tetanus vaccine. Next slide. Okay. So as you saw previously, we are an insurance company led by physicians. That means they always have your health at top of mind. Next slide. Okay, so why choose True Health New Mexico? We're going to go over these 5 reasons. Medical management approach, focus on mental health, prescription coverage through Express Scripts, provider access, and value to New Mexicans. Next slide. Okay, so medical management. Our nurses give personalized support for transition of care, finding primary care providers, reducing ER visits, and preventing readmission. The outreach to engage high-risk and chronically ill and complex care issues. Our nurses also coach members in self-management. This includes asthma and diabetes control, ensuring appropriate level of inpatient care. We also combine technology with personal outreach to improve our members' health and help reduce costly and unnecessary services. Okay. Next slide, behavioral health. So True Health recognizes that physical health and behavioral health are strongly connected. Our behavioral health services support your wellness. We keep our behavioral health managed care in-house, and with behavioral health case managers, rather than employ a third party to make these determinations about our members' behavioral health care. We encourage our members to develop relationships with behavioral health providers, just as they would with their primary care providers. We have specific behavioral health tools and resources for members with chronic conditions. We offer behavioral health assessment and screening tools that help members know when they might benefit from behavioral health provider care, and we also offer $10 copay for behavioral health office visits to kind of help remove that barrier. Next slide. Prescription coverage. So we work to remove financial barriers whenever possible. Prescription medications are integral to maintaining good health. You are automatically covered under all the prescription drug programs through Express Scripts. So for more details, please review your summary of benefits with Express Scripts. Next slide. So with True Health New Mexico, we have an extensive statewide provider network of over 10,000 providers, including some of border cities of Texas. This includes El Paso and Lubbock. Some of our hospitals that are in network for Albuquerque are the UNM Hospital and Lovelace Hospitals, and popular providers are UNM, Lovelace, Optum, New Mexico Orthopedic Association, and Women's Specialist. Next slide. And also as a reminder, we are contracted with Presbyterian outside of Albuquerque, so down to Hobbs and up to Santa Fe. So Santa Fe hospitals include Presbyterian and Christus St. Vincent, and popular providers are Christus St. Vincent, Southwest Care Women's Health, Family Medicine and Pediatrics, and Arroyo Chamizo Pediatric Center. All out-of-network care will be emergency and urgent care only. Next slide. So with True Health, we do have some perks. True Health New Mexico is committed to providing quality care and lowering healthcare costs for New Mexico. We have a deep understanding of New Mexico's unique healthcare needs, coverage that's comprehensive, accessible, and effectively managed care, helping our members achieve their best state of health so that they can live happier, more productive lives. We believe our value-added perks are really focused on personal high touch point for our members. Next slide. So our nurse line. So we have registered nurses that are available 24/7, 365 days of the year, and this is exclusively for our members. This is at no cost to you, and there's no limit how many times you can call. The number is located on the back of your ID card. We recommend putting this in your phone as soon as you can. That way, if you're sick laying in bed, you can give them a call. They provide medical guidance for non-life-threatening illnesses and injuries, and if at any time the nurse feels that your care should be escalated, they will connect you with MD Live. Next slide. MD Live. So these are doctors that are licensed in New Mexico, and they're all in our network and have an average of 15 years of experience. And it's the same cost as if a regular visit. Next slide. So we have some member wellness programs. Our new wellness program is called Trueview. It's a robust, comprehensive 3-part program. This is an exclusive, no-cost wellness tool for True Health New Mexico members. And these programs, tools, and resources are designed with your lifestyle and needs in mind. You can read about this on our website and feel free to reach out to myself or your representative for more information. Next slide. Better You. So Better You is the app for True Health U program. You can access it on your mobile device or desktop. We will be sunsetting the Fitbit program at the end of 2020 in lieu of this new open platform. If you have yet to receive your Fitbit, you still have time, so I encourage you to do so. This is an open platform, meaning you can use any fitness tracker such as Fitbit, Apple iWatch, or Garmin. You can even just use your health app on your iPhone without a wrist-worn tracker at all. This platform encourages physical health to help you feel better through nutrition and exercise. It includes workout programs, healthy eating tips, and financial and work habit advice. You can challenge yourself and win rewards through the app. Next slide. The second part of True You is Mindful You. It's an online mindfulness program with access to the Mindful Center facilitated by nationally known mindfulness coach Michelle Duval. There are mindfulness resources as well as self-paced training as part of our commitment to assist members in managing stress and mental health. I encourage you to go up to the website for more details. Next slide. And Informed You. This is the third part of True You, is Informed You. This is a health education resource to help you answer and navigate questions and concerns you have about your physical health. Again, there's informational flyers regarding True You posted on the Resource Center. Please feel free to reach out to myself or the sales team, and we will have more information at the walk if you attend that next week. Next slide. Okay, on the member portal, members will still be able to access everything that they have in the past with the addition to the new True You wellness platform that we just discussed. slide. The website. So we have updated our website. You can see the changes in a couple ways. True Health New Mexico also has a YouTube channel that can walk you through a brief tutorial on where to access certain items within the website. This also includes a nice tutorial on the provider search tool. If you'd like a walkthrough, call us and we can help you also. Next slide. Okay, so let's discuss the 2021 plan design for next year. Next slide. And I know it's a little hard to read. So for primary care copay, you're going to have a $20 copay. Specialists are $50. If you go for preventative care, this includes your physical yearly exam. That will be covered at 100% for women's health care and preventative health care services. All virtual and telehealth visits are $20 copay, same as your primary care. Single deductible is $500, and for family, it's $1,250. Your co-insurance for your plan is 20%. Your out-of-pocket maximum for one person is $4,000. If you have a family, it's going to be $12,000. Your copay for lab, x-rays, ultrasounds, and all other diagnostic testing is $20 copay. Inpatient hospitalization, inpatient surgery, and outpatient surgery will all have deductible, which is that $500 plus your 20% co-insurance. Urgent care is a $50 copay, and emergency room is a $350 copay. Your family out-of-pocket maximum is $12,000. Let's see. Maternity services. So prenatal, postnatal care, and OB delivery charges is a $50 copay, initial visit only, and then the plan pays 100%. Your hospital admission will be your deductible and your co-insurance of 20%. Behavioral and mental health outpatient services is just a $10 copay with a $260 annual maximum. Your inpatient services are deductible and that 20% co-insurance. Alternative therapies. We offer acupuncture, chiropractic, massage therapy, and rolfing. Combined, you only get 25 visits per year, and that's a $20 copay. Okay. We do have diabetes coverage, an office visit, and education is a $10 copay with a $260 annual maximum. Your medications, please refer to your drug plan with Express Scripts. Diabetic supplies, equipment, and appliances will be paid at 100%. Durable medical equipment, supplies, prosthetics, functional orthotics, they all require prior authorization, and that's a 20% co-insurance. Deductible does not apply. Your lifetime maximum is unlimited. In prescription drugs, please refer to your formulary with Express Scripts. Okay. And next slide. Okay, so if you have any questions, please feel free to contact me. My name is Fallon. My phone number is on the screen. We all are working from home, just like I assume you guys are. So I will have my cell phone on me. You can always email us at enroll@truehealthnewmexico.com, or you can give the sales number a call also. And I think we are ready for questions.
Sorry, everybody. I'm actually toggling between two webinars. So I was frantically doing your screens. Thank you all so much. We are ready for questions, and we have a couple of questions here. Lillian asked if this is an HMO. So Fallon, if you could kind of explain to her that difference, that would be great.
Yes, so the Albuquerque Public Schools program is an EPO, which technically is an HMO. That means you have to go in network for the claims to be paid. The only time you can go out of network is if it's emergency and urgent, and that will be paid at 100%.
Great. Lily, if you have a follow-up question to that, just let us know. Am I able to use True Health if I'm traveling out of state and have an emergency? I believe you just answered that, but
yes, ma'am. So if it's urgent, then yes, you can use it and it'll be covered at 100%. And we will work with that company or that provider to get the claim paid.
And just to clarify, hi, sorry, this is Ann Johnson. I'm one of the benefit analysts here at APS. Just to clarify that as well, you do have a copay for emergency services, whether those emergency services are here in New Mexico with a True Health contracted provider, or with a non-True Health contracted provider. If you have an emergency and they take you to the nearest hospital that may not be a contracted provider with True Health, again, you'll have your copay for that. And that's the same if you're outside of New Mexico. After you pay your copay, Keely, I'm sorry, just jumped back and forth. Fallon is correct that will then be covered at 100%.
Yes, thank you.
Great. And Lillian had another good question. First of all, I'm Becky. I'm Becky McGregor. She put question mark McGregor. How much does it cost to give birth? That's a great question.
So I did go over that earlier, and I'm sorry if I went a little too fast, but Maternity Services, your hospital admission for delivery will be your deductible plus your coinsurance. So the deductible is $500 and the coinsurance is 20%. So depending on the hospital, every hospital has different pricing. And then your prenatal visits and your postnatal is that $50 copay initial visit only.
I was going to put that back up for people and share that again. Just know that this is on that link. We will have, as far as these individual plan summaries on the aps.edu human resource benefit page. And I put that link in the chat, but there's the maternity services. And I realize it's a little hard to read. It's the going between PowerPoint and Google that tends to mess up some of these font selections. And then Lillian also asked about the out-of-pocket max. So I will pull that back up around for you all.
So for an individual, it's $4,000.
Okay. So the one that's listed there has family. Do we have?
It's right above it.
Okay.
$4,000 for an individual and then $12,000 for a family. So if you have 8 people in your family, like I do, you would only pay $12,000 out of pocket. It's not $4,000 per person. It's once you hit 12, then you're good.
Okay, great. Thank you. And another good question, which Ann Johnson might have to answer. Ann Usinger asked, can we still have this insurance when we retire? And I believe that's a question for Ann Johnson to answer. Is she still on?
Sorry, I'm here. I just was talking without with my microphone off. Oh, hi, Ann. This is another Ann Johnson. When you retire from Albuquerque Public Schools, you are no longer eligible for the APS medical plan or other benefits, but you will be eligible through the New Mexico Retiree Healthcare Authority to elect one of their medical plans. So when you leave APS, when you retire, this plan will stop, but you will have the option to enroll for one of the New Mexico Retiree Healthcare Authority plans. The other question, I can't really tell who it's coming from, is what does UNM Hospital charge for a normal birth? And that is not a question that I can answer, Fallon. I don't know if you have an idea of how much a normal birth is running.
I don't, unfortunately. What I suggest is prior to delivery, you typically register with the hospital that you're going to deliver at, and they can give you an estimate so you have an idea. Each delivery is different. I can tell you from experience, I just had a baby a year ago, and my delivery didn't go as planned. So you can only get so much kind of heads up. You know, you would have to do the research with that specific provider, because we have different contracts with every provider.
So yes, definitely it is a question that you could ask of, when you register and let them know that you're planning on having your baby at UNM Hospital. They should be able to give you a range of, how much a normal delivery costs, no complications. And again, as Fallon pointed out, babies are very complicated and they do not always follow best laid plans that you might have. So again, the thing to be aware of is that you will pay your deductible, which on the True Health plan is $500 for 2021. And then you will pay your you will pay your coinsurance, which is 20% of those charges. And then you will possibly, the thing you should be aware of is you have a safety net, and that is called the out-of-pocket maximum. The out-of-pocket maximum on the True Health plan for 2021 will be $4,000. So if you have a delivery that does not go, as Fallon said, as planned, and it's very expensive, or there are complications with the delivery, then you will possibly meet that out-of-pocket maximum. So just be aware that that's your safety net. You're not going to pay 20% of, hundreds of thousands of dollars. You're going to cap at $4,000.
Correct. So typically a birth that has no complications is around 5,000. But you also remember we have contracts with that provider to get a lower price. So it may be 20% of 4,000, not of 5,000. So that's why I suggest you always reach out to the provider to kind of get an estimate of what their bill charges are.
And Lillian is pointing out, which she's correct, that it's difficult to make a decision about which plan is going to be best in your specific situation without some more specific examples. So Lillian, if you want to come off mute, and I notice we have about a dozen people who are still on this call. So if any of you have questions that you would like to discuss, and you're open to doing that in this kind of open environment, then we will do our very best to address those questions. Fallon will have True Health information, and I will have an overview of the other benefit plans that are available, the other 3 medical plans that are available. So Lillian, again, if you would like to come off mute and answer those questions, we would be glad to answer them. The other thing that you may find, oh good, I see that Fallon answered the question. The other thing that some of you may find helpful is there is a comparison of the 4 plans, and it is posted on the APS Benefits Department webpage. If you go to that webpage, you're going to scroll down to the 2021 open enrollment information, and I can't remember exactly what it's called. I think it says Medical Plan Comparison Grid or something. You can look at that, and that will show you, going across what your benefits will be for each one of these plans. And one of the big things that people need to be aware of is that there's differences in networks. And the True Health plan contracts with Loveless medical facilities, the Loveless Medical Group, with UNM Hospital, with UNM Medical Group, obviously with a lot of other, medical groups and in town. They do not contract with Presbyterian Health Plan, which if you want to see with Presbyterian docs. So if you want to see a Presbyterian doc, or you want to go to Presbyterian hospitals, this is not a good option for you.
And I do want to state, outside of Albuquerque, we are contracted with Presbyterian. So if you're in Santa Fe, if you're down south, we do have contracts with Presbyterian outside of the Albuquerque area. And I also want to mention, it wasn't asked today, but it was asked yesterday, a question about providers. If you like your provider, can you stay with them if you switch to True Health New Mexico? As long as they're not a Presbyterian doctor in Albuquerque, if they're not contracted with us, we can try to get contracted with them for you. We do that quite a bit. So all you have to do is email me at that enroll@truehealthnewmexico.com, and we can try to get that ball rolling for you.
And Fallon, thanks for including that information. Again, outside of what's called the 4-county area, which is Bernalillo, Sandoval, Valencia, and I always forget the county that Edgewood is in. Is it Torrance?
Torrance, yeah.
Outside that 4-county area, if you live outside that 4-county area, then yes, you can go to a Presbyterian doctor or hospital on the True Health plan. If you live inside that area, then again, Presbyterian hospital and medical group is not contracted with True Health within that 4-county area. So just be very aware of the differences from that. So, hi, Arla, you said you joined late. For True Health New Mexico, Presbyterian Hospital and Presbyterian Medical Group are not contracted with True Health New Mexico here in Bernalillo, Sandoval, Valencia, and Torrance counties. So if you want to see a Presbyterian doctor, then you will probably want to consider either Presbyterian Health Plan or Cigna Health Plan for your 2021 election.
Right. I think we've answered all of the questions. And obviously, I'm just going to do a little wrap-up slide, but if anybody feels like they need to get something answered special, we'll hang on for you all while everybody else leaves. But let's just wrap things up here with a couple of quick reminders. All of the open enrollment information is on that intranet APS EDU open enrollment landing page. And we've also given you a couple of slides on or notices in the chat box where you can find all your comparison sheets, the premium payroll deduction rate charts, as well as the plan summaries, which will be posted probably later today. And that's on that aps.edu human resource benefit webpage, and that link is also in your chat box. Oh, and we also just want to remind you about our financial wellness webinars tomorrow, Thursday, October 1st. That schedule I had up right here tomorrow. So you can see we have 7:30 ASI Flex, 11:30 New Senda, 12 o'clock the education plan, and 3:15 the standards. So we have those coming up tomorrow for you. The links are on that open enrollment page. We have that Google Calendar right there on that open enrollment page for you. So you can join us. There's going to be a lot of great information on those. We have a wellness walkthrough event Thursday. I just passed over number 3, which is very important. Online, our open enrollment is going to be completely online this year using your Winocular workspace system. So what that means is, it's a very familiar system for you all. You're used to going into Winocular, but this year you'll be able to also do your open switch enrollment. We are going to have webinars walking you through that process on Monday, October 5th and Tuesday, October 6th. The links and times for those are also on that main open enrollment landing page. So you can please join us for one of those. All of these webinars will be posted on the APS YouTube channel, Expect Great Things, under Employee Benefits. So if you by chance can't make one of those, you can log into one of those webinars. Just know that it takes 24 to 48 hours for us to get that turnaround time in for that webinar. And again, we have that wellness walkthrough event Thursday. So this is just a complete hand sanitizing, mask wearing, socially distanced walk-through event to provide some important preventive health services for you. We know that in years past, we've had these awesome health wellness fairs, and this year we can't really provide that, but we definitely want to provide some preventive wellness for you. So we have vaccinations, and all the information on the vaccines is, again, on that open enrollment page. There's a special vaccination page that gives you the information you need to have available with your prescription benefit or medical plan card, as well as the consent form. We ask you to fill the consent form out before you come because it helps expedite the line. We also are going to have mammograms and a blood donor drive with free COVID antibody testing. You do have to sign up for those, and the appointment links are on that open enrollment landing page. For the blood donor drive, the antibody testing is only for those who donate, and that has been filling up, so I encourage you, if you're interested, to get in there today and see if there's any slots left. We do ask, do the public health order. Please don't come to City Center. We are hosting everything on Thursday and Friday, October 8th and 9th, from 8 to 3:30 at Bonifacio, and that is off Comanche and Louisiana. And all that information is on the open enrollment page again. We will have laptop stations there. If for some reason you need help with open switch enrollment after you've watched the webinar, then we're going to be there to assist you as well. Okay, and just for attending, you're a winner, but we're also doing a raffle for prizes, and I will let you know if you win, because we have a list of the attendees. We've got 7 people left online. I'm going to stop recording, and we will address anything individually that needs to be addressed. Again, just thank you all so much for joining us. And that concludes our presentation. I want to again thank Fallon from True Health New Mexico. We appreciate you. Thank you.
Thank you.